All right, we in there. So again, sorry about that, Lunch and Learn community members. I am Dr. Pierre, your favorite board certified internist, founder of drpierreblog.com. I have obviously a special guest with me today. We have Dr. Sabine Elisee. She's going to be schooling us, educating us, enlightening our minds on the flu. And we know flu season officially starts October 1st, right? October 1st is officially flu season, and we're already feeling the brunts of it. I am inpatient. She is outpatient. When we're already starting to see the rumbling, right? So before I want to begin, I want to go ahead and introduce and let Dr. Elisee introduce herself to the Lunch and Learn community.
Hi, Lunch and Learn community. So to be on this side and actually speaking to you. I'm usually, like you, listening to Dr. Pierre, giving so much information of the Lunch and Learn, empowering us with our health. Yes, even as a physician, we constantly need to be empowered with our health. So I am Dr. Sabine Elisee. I am a board certified family medicine physician. I have a fellowship trained in hospice palliative care. I have a master's in public health, a couple of different hats. I'm a wife, a mom, and just like you, trying to figure out what to do in this world, how to stay healthy, and just keep on keeping on, essentially. And it's an honor to be with you. We'd like to talk to you a little bit today about flu, and we're going to get right into it. I do have to say, and I said I was going to add this, I don't even know if this is okay. So you have to know just this little fun fact about us as well, too. So Dr. Barry Pierre is actually my mon compère. Now, you don't know what that means if you're Asian. There is no actual term for it in English, but a mon compère means that I am actually the godmother of his second daughter, Brooklyn, and it's a great thing. So happy to be here with my mon compère.
Yes, I love it. And again, I think, who better, to be and have our first, right? For those who don't know, we've done 58 of these things, these Lunch and Learn videos, and who better to have the first guest, right? Than my friend, an amazing person, right? Just a person in general, not even amazing. Yes, she's an amazing physician, but just an amazing person in general, to talk about something that we take very serious, which unfortunately we don't think a lot of people take very serious, which is the flu, right? Like I think it's, we behoove ourselves to understate the importance of the flu, right? I think when it gets to this time of year around, I think a lot of people kind of blow it off like, oh, it's just like I said, it's just a flu. And very interesting, just yesterday, in fact, just either yesterday or this morning, article came out. We have 80,000 people died last year from the flu. Yeah. 80,000. Right. So again, this is not a disease that only gets old people. This is a disease that is taking a lot of people out. So, we're going to start off, we're going to hit home a few points. One, we're going to talk about, really what is the flu, right? What are some certain symptoms that we tend to deal with? What are some complications that we tend to deal with? What are some excuses, right, that we tend to hear a lot, right? Remember, I did outpatient medicine for a few years, and I hear a lot of excuses, even when they come in the hospital, why they don't want to do the flu, right? So like, let's sit back again. It's going to be a very informative episode. I hope you guys get some learning on. And of course, it will be in the notes. So I'll have a blog post out probably later today. If you can't catch it, it'll be on the YouTube page as well. And at the end, we'll also give you some information, because even if you don't want, maybe you don't want to listen to me no more, right? Maybe you say, you know what, after 59, I'm done listening to Dr. Barry, right? But you want to listen to someone like Dr. Elisee. Like, we're going to give you her information so you can follow her and pester her, right, with your medical questions and learn from her, right? Like, that's really the goal.
So it's definitely a good thing. Pester me, follow me, all of that. It's all good. But I'm sure you'll continue to listen to Dr. Pierre as well.
Oh, that's it. So I just want to we'll get some facts, right? Like, what are some issues when we talk about the flu, right? Because again, it's something that, especially during this time of age, get mixed around with like the common cold, right? And again, it is not the same. From a symptomatology standpoint, a lot of people who deal with the flu, they deal with symptoms of fevers, chills, back pain, just aches, right? Like, this is one of these viruses that really take you out, right? Like, this isn't like you're coughing a little bit. No, this is you're coughing a lot, You can't eat, you can't sleep, you're in pain everywhere. Dr. Elisee, like, what has been your experience with the flu, especially in your patient population, where you're kind of the front line, where they come into the office probably all the time, especially around this time frame when they're seeing all of these commercials from Walgreens and the CVS of the world say, "Come get my flu shot." Like, what are some of the things you're seeing and you're trying to say, like, no, I don't think you got what you think you got?
Definitely two things that we want to discuss here, and you touched on it, Dr. Pierre. So wonderful thing that this is a virus, right? So we need to understand, again, our Lunch and Learn community, virus versus bacteria infection. Bacteria infection, we have the antibiotics, we give them to you, we get it, we kill it, it's gone, it's dead, done. Virus, not so much. We don't have any to kill a virus, right? So what we're actually doing is just treating your symptoms. You'll know about Tamiflu. You'll hear about that, to take that within the first 48 hours. But that is only just gonna hopefully diminish the time in which you are infected. So that's number one. This is a virus. And if we can prevent a virus, by all means, prevent the virus, because we don't have anything there. The other thing is that while, we think of flu, we're thinking of, oh, we'll have fevers, but not everyone has fevers. You could walk around just coughing and having the sore throat, having the body aches, but you're not necessarily spiking the fevers. So you have to be very careful with that. And because I am primary care medicine, our front line is all about prevention. If we could prevent this from happening, let's prevent it. So one of the things also too that actually occurred last year, right around this time, I go and I ask each and every one of my patients, are you getting the flu vaccine? Do you plan on getting it? If not, why? And then we educate and we give the reality. If you follow me on Facebook, on Instagram, you'll know my saying, it's your health, it's not mine. It's your say this, but
gotta be honest. Gotta be honest with them. Like this, if you get sick, that's you getting sick, not me.
Will you die? So I'm saying this essentially to my 30-year-old, overall healthy. I don't have any comorbidities. I'm not around sick people. I don't have any immunosuppressed people in my family. So I don't need the flu vaccine. Okay, you don't need the flu vaccine. You don't get it. You are going to get the flu and you're going to be miserable. You are going to be miserable. And I will be completely transparent with you, because I was that person that's out there thinking that. I was like you. In residency, I got my flu vaccine every year. Before medical school, getting the flu vaccine. And then the 1 year I decided I'm not going to get the flu vaccine. I got sick like a dog, the flu. And I said, never again. If there's ways to prevent this, why am I putting myself through this misery? Why on my only little time, and that was during the Black Friday weekend of Thanksgiving, little time off, why am I going to put myself through this? So number one, we want to go out there and get the flu. I have had patients in the past, unfortunately, just last year, who decided not to get the flu vaccine. And this, granted, was an elderly patient. But what happened with her is she didn't get the flu vaccine. Her children didn't get the flu vaccine. So she got the flu first. She was hospitalized, never really got back to where she was, went home, got the flu again from someone in her family, and unfortunately passed away this year. So she never really recovered. And that's what we're talking about right now, is that your flu vaccine does not just help you, but this is the reality of what herd immunity is all about. We're giving everyone the flu vaccine, as many people as possible, so that we could create herd immunity. What is herd immunity? If I vaccinate myself, I vaccinate Dr. Pierre, I vaccinate his wife, my husband, this is going to be less likely to bring the flu to our children. So them vaccinated, they're going to be covered because we're vaccinated. And all of us want to do our due diligence, essentially.
Now, you talked a little bit about like comorbidities, right? Especially because, I feel like this lunch and learn is really going to be important for like that 30 to 45-year-old patient, who probably even younger, right? Who really walks around super invincible, right? What are some comorbidities that if I have, I'm at a higher risk to dealing with said flu?
So number one, and if you are on the Lunch and Learn, Dr. Pierre talks about this all the time, you're a smoker. I don't even know if I should.
First of all, why we got to ask them, why are they still smoking? In
Grant
2018.
understand that, and I say this truly for my 50-year-old and older, we didn't understand the complications before, but you're 30, you are in your 20 range. We know the complications, we know the risk. When we listen to your lungs with our stethoscope, we literally hear the difference on how your lungs are expanding or not expanding. So for someone like you, if you get the flu, it's more likely you're going to have the complications, more likely you're going to have the pneumonia, more likely you're going to have that chronic bronchitis that kind of hangs around and sits around. And again, it's going back to what we're saying. This is a virus. This isn't a bacterial infection. This is a virus. So we don't have a cocktail of antibiotics to give you to get rid of it altogether. So that's the number one thing. The other thing is our COPD patients, our diabetic patients. These are the comorbidities we're talking about. Our sickle cell patients. And I would even venture to say our sickle cell carriers, sickle cell patients who are carriers, and absolutely our pregnant patients. These are the individuals that we are looking at, and they fall right in that age range that you need the flu vaccine. Why? For prevention, to protect yourself, to keep yourself from going through the misery that there is of when you do have the flu or when you get it.
And and just remember, especially community members, like when you get the flu, a lot of times you're contagious like a day or so before you even experience any sniffle, any pain, any ache. And that contagious window lasts for about 3 to 4 days after you start getting the body aches and pain. Now, unfortunately, and I think Dr. Elisee kind of really hit on it, a lot of times y'all come to us on day 3, right? Like y'all want medication, and we already, she already said it, Tamiflu is great in that first 48 hours, right, to decrease symptoms. But y'all come to us on day 3 and then you're upset because we're like,
can't give it to you. Not gonna. And I want to give you those numbers too, Dr. Pierre. You mentioned it. CDC is noting that time period that when you're contagious. So you're contagious in the first 3 to 4 days after the illness, 1 day prior to you having any symptoms at all, and 5 to 7 days after you have any of those symptoms. That is your entire time of you being contagious. So again, don't think that because I'm not having these fevers, because I'm not coughing as much, because I'm using these different oils or essential oils, or taking my echinacea, taking my vitamin D, taking my vitamin C, I'm good. I'm gonna double down on my emergency packets. And while I'm at work, I'm spraying Clorox everywhere. It really comes down to, for me, if you could prevent something, prevent it.
Mm-hmm. And I think the prevention, and for another caveat, again, this is like my sister right here. We both have a master's in public health, right? So a lot of times when you hear us talk, it's not necessarily the medicine side of us that's talking, but more importantly, the public health side of talking, right? And sometimes I think society is spoiled by the public health success in regards to what we do with certain diseases, especially the flu, right? Like, again, I want to just give you a quick numbers, right? And let me say, where is, in 1918, 50 million people died from the flu, right? Like this again, and I think a lot of times we take it for granted because millions of people aren't dying from the flu anymore. So we don't really give it its credence. But again, we just talked about the link where 80,000 people died just last year, right? And that's a high. And I have my theory of why that's happening. I know Dr. Elisee has her theory of why that's happening. And we'll definitely talk about that in a little bit. But this is we're dealing with a disease that at one point killed 50 million people, right? So again, this is a serious disease, right? And again, I know you guys have millions of excuses of why you don't want to take the flu shot. A lot of them just aren't good, right? And I have to be honest with you, right? Like we have to be honest here. Lunch and Learn community members have to be honest with ourselves. When you go to the expert, right, which is us, right, and you give your reasons that you may have read or someone may have told you, you have to be willing to accept that. Like if we laugh when we say that makes absolutely no sense in the world.
Yeah, and I'm gonna play a little bit of devil's advocate here because there's a portion of it where I hear some of these excuses where I'm saying not so much, but then I do hear the excuse of just the distrust of the medication, the distrust of government, the whole conspiracy theory. Historically, when you're looking at something like Tuskegee Airmen trial and why a lot of people don't want to get vaccine, go into research, whatever it may be, that is a true reality. We're not telling you that that has not happened. That is a horrible part of our history that we don't like to talk about. But here, as a physician, I'm letting you know I understand what you're saying, but we have come so far now in the regulations that are in place. That's why you have FDA approvals. That's why you have research that's done. That's why you have testing. That's why you go through so many standards of things getting tested repeatedly on a smaller population, then on a larger population, and then again on a larger population before it's offered to us. This is the beauty, honestly, of living in the United States of America because we are so regulated in this matter that when we talk about things like the Tuskegee Airmen trial that happened years ago, that's not occurring now. That the flu is not giving you the flu. It is not a live vaccine, number one. And we confuse causation with association. So the causation that a lot of people are attempting to say, and usually saying that, well, the flu vaccine gave me the flu, it's impossible because it's not a live vaccine. The association is that you were probably getting sick anyway, and it just so happened that you got a flu vaccine. So that's the easiest thing for you to blame it on. And that's what is occurring. So I do hear you, those of you who have this conspiracy theory mindset. And in all honesty, I'm right there with you sometimes. Part of the reason why I went into public health to understand this more. But I am reassured because there are so many levels of testing and retesting, it's not giving you the flu. It really isn't.
Now, Dr. Elisee, I want to kind of play a game where I am the patient. And I'm just going to give you a list of excuses that I have heard over the years of, why I can't get the flu shot. And, please, especially as a physician, please give us what your reaction would be, because this is what we're going to hear really for the next 4 to 6 months of why, our friends and family members and close colleagues and patients are not going to get the flu shot. So like number one, right? Like I don't, and I think you just touched on it, right? I can't get the flu shot because every time I get the flu shot, I get sick with the flu, right?
Number one, that answer is, again, going back to causation association. And I'm glad that we're doing this because part of why Dr. Pierre and I myself love what we do is we love to educate. So the more that we educate you, the more that you'll be able to make an informed decision. So this is your informed decision now. One, the vaccine did not give you the flu because it is not a live vaccine. And because it's not a live vaccine, it cannot give you the flu. And these vaccines that we give don't go giving anyone the flu at all.
So number two, I am too young to get the flu shot.
Right. So now, based on the research that was done, the numbers that are reported, and this is for years, particularly CDC, Center of Disease Control, that look at these numbers, the actual high-risk patients are those who are actually younger than 5, because you'll find the parents coming saying, I don't want to give my children the vaccine. If they're 5 and under, give it to them. If they're past 6 months old, they can get it too in 2 doses. Give it to them. They need it. So you're not too young to get the vaccine. And then even now, we even have some of our patients who are 65 and older who also think that they're too young, because I guess 65 is the new 45. And they do need that vaccine as well too, because these are all the individuals that we find have an increased risk. And what is your increased risk? Your increased risk is that you're going to get the flu, you're going to get hospitalized, and your body will not have the ability to fight and get back to your baseline of where you need to be, which will cause you to possibly be intubated, get pneumonia, all these different complications that could occur. And that's what makes someone at risk.
Now, I think this is a good one. I already had the flu, so I don't need the flu shot.
You had the flu and you could get the flu again. Now, and I'm still not convinced that you actually had the flu versus postnasal drip versus just a cough or just allergic rhinitis, right? So that's the biggest one that we'll hear. And I'll just describe some of those symptoms quickly of the postnasal drip, which is the biggest one of, I just feel something in here, doc, like really in there constantly. That's part more of a postnasal drip. We look in your nose, we see enlarged inferior turbinates. That's the thing that it is. But just the idea that if you got the flu once, that in this season, that doesn't necessarily mean you can't get it a second time or a third time or a fourth time or a fifth time, because this flu season goes until right now, from now, so 2018, October, all the way into March 2019. And yet we still see people getting diagnosed and still having real symptoms, testing positive for influenza A or B, even into May. So you're talking about a season that runs fairly long. We're going before Halloween and Thanksgiving, and we're going after the New Year, after Valentine's Day, after Martin Luther King Day. We're going all the way into May. So that is a long period of time where all you have to do right now is just get the vaccine.
And I think those are some of like the biggest, those are the more common ones I get to experience a lot of times. And sometimes I think people, when they get the flu shot, a lot of their concern is just very normal reactions from getting the flu shot. Like, what are some common things that just happen when you do get the flu shot that are kind of supposed to happen when you get the flu shot?
So what is supposed to happen? You're going to get soreness because that's an injection at the site of the injection. That's normal. You're going to get the muscle aches and pains. That's normal. Will you get fevers? Possibly, but really not likely. Everyone is a little bit different, but the biggest ones that we hear most about, at least that I hear most about here, is this soreness and this injection site pain. That is normal. That will happen with anything. And I think what tickles me pink is when I see the patient who has a full tattoo sleeve of down their the neck, right there on the eye, tattoos, and they'll tell me, I'm not going to get the flu vaccine, Dr. Elisee. I'm afraid of needles. Not so much. Not so much. So our job is to educate you more than anything else so that you can make this informed decision to truly protect you as well as your family members.
Right. And again, I think I have to, I'm more controversial in that I blame the healthy age group of getting everybody sick, right? Like I'll go on my soapbox, right? I really feel that because of the lack of herd immunity, right? Because of the lack of, and this is a common excuse, oh, the flu shot does not work, right? We know it was about 40% effective last year, right? But you know what we also know? That only about 40% of y'all who's supposed to get it actually got it. Right?
Yeah. Yeah.
So what do I do with that, right? When people who should get it, again, about 60% of people who should have gotten the flu shot did not get the flu shot. And then when we see reports like 80,000 people died last year, and that's just died, right? A lot more people went to the hospital, right? A lot more people got treated with Tamiflu in offices and had to miss time from work and had to miss time from school. A lot more people got sick, but we had 80,000 people, which again, highest number. And it just continues to go up as the years has gone by. Like, what do I do for those 60% of people, right? Like, how can, even with all this evidence, I can turn around and try to convince them, like, hey, man, we need you to do this.
So I think that we are in that sector of that population of our peers, essentially, Dr. Pierre, is that we're too smart not to get this. We're too smart not to understand the numbers. We're too smart, and we make advances. We're movers. We're makers. We make things happen. And for there to just be really just the ignorance and a decision to just not listen and to prove that Dr. Google or then the physician who has been trained or your friend down the street knows more than the physician who has gone through training, who's been studying this, who's been researching this, who understands the epidemiology behind it. It is just ignorance. And this is where I too am baffled, because I still do not have the cure for ignorance, and I do not know how to speak of ignorance, but I do know how to educate, and that's what this is all about. And we're saying to you, even what Dr. Pierre is saying, when we're looking at these numbers that are reported, you have to understand too that flu is not a mandatory reporting illness. So we are definitely not even hitting the real numbers of what the CDC was able to produce last year. That was just from, you know, what occurred at the hospitals and possibly what they were able to capture. But we're truly not capturing it at all of actually what is going on. And that is where I do say to that healthy person, more than just for yourself, but possibly that elderly patient, or possibly that young child, or just that person that you see at your local supermarket, for them. And I know that you have the decency as a human being to understand that and know that, but at least give it a thought. At least consider what we're saying to you in the sense of why this is important. And unfortunately, we live in a society where we have a lot of discussion, but not dialogue, and not everyone really listening to each other's side of you. And that's what I'm saying to you today, that while I understand your apprehensions, I also want you to understand where we're coming from, so that we get, the both of us can at least come in the middle to get an understanding of why this truly is so important for us to do this, because it's affecting us, it's affecting our productivity, it's affecting our ability to move forward. And at the end of the day, it really causes many family members to suffer. I spoke to you earlier about this patient that I had who passed away last year from the flu. And it was truly the hardest thing to speak to her son, her adult son, who was taking good care of her up until this point, about funeral arrangements, about advanced directive arrangements, because it got to that point where she continued to decline. So he lost that time at work, that productivity that he had as well too, as a result of people like you and people like me who are wondering, is the flu vaccine really necessary? And it is.
And I think you really hit home, because there's, especially now that I do inpatient medicine, there's a few diseases that I hate for that disease to be the reason why you're not going to walk out my hospital, right? One of them, and you know, I've been on record, is colon cancer, right? Like colon cancer, again, one of the slowest growing cancers, period, right? So when you get to the point when you're at end stage colon cancer, a lot of signs got missed, right? But most importantly, the other one is flu, right? Like understanding that all you had to do is do the vaccine, right? And maybe you got the vaccine, but you know, one of the super people didn't get the vaccine, and they gave you a strain that the vaccine wasn't ready for, right? And then you ultimately don't end up leaving my hospital, right? It's definitely one of the toughest things to really explain, right? I have trouble even explaining it to my patients that, yes, she got the flu, because again, I can tell you right now, it's not the flu that's going to cause you not to walk out of my hospital. You'll get the flu, then you'll get respiratory distress, and under your respiratory stress, you'll get pneumonia, and then it just goes downhill. Right. Yeah. So again, don't think it's the flu only that's causing it. You're not gonna, not walk out of my hospital because your muscle aches so bad. No. You're gonna not walk out of my hospital because you can't breathe, and you need a machine to breathe. And then when you need the machine to breathe, you got pneumonia. And then when you got pneumonia overtook your body, and then ultimate demise. Right. So again, the numbers don't lie. 100 years ago, 50 million people. Right. Thank God for public health, right? So we kind of curtailed that. And not to say that 50 million people are going to die in 5 years or 10 years or 20 years, but we can't ignore the signs that our numbers just keep getting worse in terms of deaths, in terms of hospitalizations, in terms of missed time at work, missed time at school. Like it just keeps getting worse, right? So this 80,000, if the trend holds like it did last year, will be more next year, right? So I want you to really, like take that home with you. If you don't get nothing else from the two of us, right? Like, again, we understand your apprehension for the vaccine and just vaccine in general. I have a kid who's autistic, right? I got to hear about vaccines all the time, right? We understand that, right? But understand that we're talking to you not from just the medicine side. We're talking to you from a public health background, which again, sometimes I feel like my public health makes me a better, not to shy at any people who don't have the public health degree. Maybe I am, right? But like, it does make, me a better physician because I understand that aspect of it.
You're understanding a little bit differently. And, I say this, even here, if you come to the office, you'll see we all have different quotes on the wall. So Dr. Pierre and I, we're great physicians, okay? So the good physician treats a disease. The great physician treats the patient with the disease. So we're treating you and speaking to you about your apprehensions. We're speaking to you about what your understanding is about whatever it is we're talking about. But in the process of treating you, we're treating the disease too, or preventing the disease altogether. And the ones that are preventable, whether it's colon cancer, whether it's the flu, that's what we're attacking so that you as a person will be better.
Amazing. So Dr. Elisee, before we go, I know we were occupying your time. Where can people find you? How can they find you? How can they just kind of reach out and say, you know what, I need to, like this, amazing, beautiful physician, right? I want to follow her. Dr. Barry's kind of ugly and he's been talking a lot, right? Like, how do I follow Dr. Elisee, right? Like, where can they get you at?
Oh, yeah. So two things. Lean in quickly here so you can see the name really well. That's Dr. Sabine Elisee. I'm on Instagram. I'm on Facebook. I have the honor of currently being in a medical mogul class with Dr. Dre as well too. So that's just a wonderful thing, learning so much. So on Facebook, it's Dr. Sabine Elisee, Dr. Sabine Elisee, E as in excellent, L as in Larry, I as in ice cream, S as in Sam, E. And on Instagram, it's Dr. Elisee or Elisee, E as in excellent, L as in Larry, I as in ice cream, S as in Sam, E. If you go to Dr. Barry's page, you'll see my name in his link, and you could follow me from there. Like we said, we're great physicians, teach treating the patient and the disease, not just the disease itself.
Love it. Thank you very much. And what I'm going to do, especially for my Lunch Learn listeners, if you don't catch the video, it'll be on YouTube, and I'll make a special podcast episode, and we're going to put it out this weekend as well too. So however you want to digest this information on the flu, I'm going to make sure that we're taken care of. And again, I'm going to have all of her links because again, she looks better than me. She's smarter than me, right? So you're going to want to follow her. And shout out to my coach, Dr. Dre, as well. Absolutely amazing person, physician. I mean, this just absolutely amazing. Like I've talked, those who've been following me with Lunch Learn Community know my admiration for Dr. Dre. So we already know how that goes in that standpoint there. All her links will be in the show notes, in the blog post, and the links on the Facebook over here too. So shout out to her, and we're gonna see you guys later. Again, we're busy physicians, right? Like we got patients we got to take care of, but we do this right to take care of you, right? Because again, we got to educate. That's really the most important thing for us.
That's what it comes down to. Facebook Live. We're happy that you joined us today. Thanks for tuning in. You know where to find Dr. Pierre. He's your favorite internal medicine physician, mine as well too. And look forward to seeing you and linking up with you, whether it be on Instagram, Facebook. See you soon.
Love it. Thank you. We're going to end that.